Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. I want to thank you for coming out to the Syndemic Infectious Disease Continuing Education Conference. There's a lot to talk about today, so I'm going to be brief, but I do want to just set the tone. Sorry I can't be there in person. I'm traveling, or I would have been there. So first of all, some of you might be wondering about this word syndemic. The reason we're using the term syndemic is because, as you all know, when people come to us, very often they do not come with a single disease state or a single set of social drivers of health. They come as whole people. And especially where we think about diseases and conditions that have overlap and interactions between them, we want to make sure as a health department and as providers, we are meeting all of these needs. So at the Chicago Department of Public Health, we've pulled together our HIV work, our STI work, our hepatitis B and C work, and our tuberculosis work into a single bureau, the Syndemic Infectious Disease Bureau. Similar behaviors and conditions lead to risks for some of these diseases. They have reciprocal and interdependent risk factors. So common risks and modes of transmission for HIV and STI and Hep B and C, but also STI increases HIV infectiousness or susceptibility. HIV is a risk factor for TB progression. TB is an opportunistic infection from HIV. TB accelerates HIV disease. When we see hepatitis B or hepatitis C progression, that makes HIV management more challenging, etc. So common risks really should help us think about common solutions. Disease conditions, we know, are often managed by the same institutions and often the same providers. The social determinants, or I like the term the social drivers of health, include social factors that impact how disease shows up for an individual. Race, ethnicity, gender, sexual orientation, language, beliefs, traditions, norms, access to care, education, economics, all of this, as you know, impacts people's disease states. And so having the data that lets us understand a little more about these social and structural factors and how they contribute to the health outcomes is really critical as we move beyond just treating an individual disease to thinking about that whole person and their whole health. And so we think that this syndemic approach will let us better understand the co-occurrence of risk factors and the co-occurrence of some of these diseases. As many of you know, Healthy Chicago 2025 is the overarching community health improvement plan, not just for the Chicago Department of Public Health, but for the whole city. It's meant to drive our priorities as a city from 2020 to 2025. And we're particularly focused on health equity and racial equity in this plan. We focus on the drivers of the racial life expectancy gap in the city of Chicago, and HIV is right up there as one of those top 5 drivers in terms of the overall groupings of conditions that lead to the gap in life expectancy between Black and white Chicagoans, for example. We also, in Healthy Chicago 2025, think a lot about those drivers of health and how do we think about the systems, the environments, the policies that people live in and experience their lives. Going to get medical care is a piece of that, but those larger structural issues, frankly, are often an even bigger piece of that. As I know you know, if you're helping people with adherence to medications or access to treatment or ongoing needs, especially when folks have multiple disease states. And so we're going to be continuing to work on this syndemic approach. Syndemic surveillance for us means monitoring these diseases in tandem, thinking a little bit how we collect, not just that a disease state exists in a person, but some of those underlying drivers that can make it show up differently in different populations. And so I hope that for all of you as well, our work on taking a syndemic approach will lead to more cross-program collaboration, more work with evaluation and quality assurance that can happen across disease states to do some planning and really client-level service integration around that. We want at the health department, and we want all of you as providers to move from disease silos to systems of care. And that's a lot of what we're going to be talking about today. We will also be adapting what has historically been our HIV services portfolio and think about future funding opportunities that will let us do more for this program collaboration and service integration. So thinking about population-centered health homes or essential supportive services, services for persons who use drugs, HIV screening and healthcare systems, community development, housing needs, all of these things, we're really wanting to take some of the resources and the funding that have largely grown up around HIV and think about how to pull those other conditions into that orbit, even while a lot of the health department's funding sources still remain fairly disease specific. So we will be building our HIV STI surveillance and epidemiology and data work. We will also be building our public health interventions work for disease monitoring, investigation, notification, partner work for all syndemic infectious diseases. And so to enhance this approach, we're going to need to be standardizing and measuring more these core sets of these social drivers of health, variables across all different conditions. We know that implicitly things like incarceration status or income or occupation or homelessness status, receipt of treatment, gender, sexual orientation, we have a sense for different diseases, how these interact, but we are going to need your help as we are thinking about standardizing some of that data work and bringing interventions that are best practice, perhaps in one disease state, adapting them to meet the whole person, knowing that having one of these conditions often puts you at increased risk for another one, or that there is often interplay between them. And so we will be working toward those core variables for the social drivers of health. And we will also be looking to providers to ask you to think about addressing all of these conditions with this syndemic approach, supporting the whole person and their healthcare needs. So it's really critical that all of you as healthcare providers are doing accurate and timely reporting of all of these syndemic and infectious disease conditions. When we are appropriately receiving information at the health department, we can work to integrate that across the various states. We are more able to quickly get folks the interventions that can be good for that person, but that can also help to stop the spread of these disease states. So partnership is absolutely critical all the time between public health and healthcare providers, but especially when we're moving toward trying to take more of a whole person approach, one that is in line with Healthy Chicago 2025, that is meeting Chicagoans where they are. We are going to have to work together. So thank you again for coming out to the conference today. I hope that you enjoy the presentations. I hope that you ask questions, and I hope that you come away focused on how we can all do better in a way that goes beyond these disease silos and really treat better the people who depend upon us for care for these diseases. Thanks again, and have a great conference.